Okay, good morning, and thank you for joining us for our weekly update. My name is Edward Ng with the Pittsburgh Foundation, so I just want to do a couple quick housekeeping items. This webinar is being recorded and will could possibly be used for future broadcasts. Please keep all of your questions type all of your questions into the question box. If you're not sure where that is, you should have a little arrow tab on the top right-hand corner of your screen. You can push that orange arrow tab that'll push your control box open, and you'll see a question field in there. Type all your questions in there, and we will gather them and email out to you responses after the webinar. Other than that, I'm going to go ahead and hand it over to Mr. Koch.
Hello, everyone. Thanks so much for joining us today once again. These are our weekly calls that we've been having between our human services sector, our nonprofit sector, and the county task force folks, the folks that are also just doing really great work to keep our most vulnerable populations safe during this time. So I appreciate you taking the time this morning to get some updates. Just a couple quick housekeeping items. One is at the very bottom of your screen on every slide that you'll see, you can see the website address listed. That's the website for the county that has the Human Services Network information. So if any information that is talked about today in terms of websites, phone numbers, all that kind of stuff is listed at the very bottom there. So we'll go ahead and get started. We have I have a couple quick updates, as well as so does Alyssa Cholodowski from United Way and Dirk. Then we'll move it over to Dr. Fox and Bud Mertz. Jason Rigoni is with us here today, as well as Dr. Conway from the IU. Kim Phillips will give us an update on drug and alcohol, as well as Jennifer Miller from the food bank. We'll round that off with Deb Thakra, and finally Heather McLean. I asked each of our panelists if you could please keep your comments under 5 minutes so that we can make sure that we have this call within the 1 hour allotment to be respectful of folks' schedule. Appreciate that. Just a quick update from the Community Foundation of Westmoreland County and the Westco Nonprofit Network. One is, I know I say this every week, but this is probably the last week I'll talk about it. We do have our emergency assistance grants that are available to nonprofit organizations that are serving our most vulnerable populations with basic needs support. If you have not applied, go to the website of the Community Foundation. You can see the link there to apply for those funds. Those are grants between $5,000 and $25,000. That grant process will close on the 8th of May. So we've got just over a week to get your application in if you have not done so yet. I know many folks have, but I want to make sure that if you have not had a chance to do that, that you go ahead and make sure you apply for those funds. Second piece is, and the last piece for me, is really I wanted to talk about masks really briefly, because Bud Mertz is going to cover it a little bit later. There were a number of organizations that reached out asking about masks for those folks that are, the frontline workers serving, maybe serving hot meals or serving food to folks, serving our homeless populations. We do have masks available. So Bud Mertz is going to talk a little bit about what that process is. Part of that process is about emailing the public safety team and sending in a form, and all of that. All of that will be emailed to you all after the call today. So, but I'll let Bud talk a little bit more about that in his public safety report. So, all I have from the Community Foundation standpoint. Alyssa Cholodowski, do you have anything from United Way?
Yes, hi. Thanks, Phil. Just wanted to mention that our 211 network is working around the clock. We've had a lot of calls from people in response to struggles during this time, and we have seen our contact volume about double compared to this time in 2019. And these are phone calls, emails, chats, and texts that are coming in to our resource navigators from people asking for support. The biggest request has been utility and rental assistance, and that has been a growing request. I think as people savings and such have dwindled, they're turning to 211 and others for some help. We have the emergency basic needs grants that are available to people. This is up to $700 for people to help with food and utility and rental payments. That's available again by calling 211. We've also seen a lot of calls about food security, and the biggest request from people is location of food pantries. And just to give an example, last year in April 2019, we had 31 calls. Just this April, we've had 183 calls alone asking for the location of food pantries. So I definitely have seen a bigger need there, and we're very happy to be able to provide that information, in particular for our Westmoreland residents. And also thank you to all of the providers who have put in new information into our database. We've seen the records and resources grow tremendously, which I think is a great testament to the work that's going on in our region to support people in need. Two resources I wanted to bring up that are fairly new is we have a partnership through PNC Foundation and Eaton Park Restaurants to provide meals to families. These are in support of what's going on through our school districts. So we started this program 2 or 3 weeks ago in Jeanette for Westmoreland County. It's also running in Allegheny County and Butler County with some school districts. These meals are given out on Friday, and they're meant to last through the weekend and support families. So the children are getting meals during the week, but the adults in the family are also struggling. And so these meals are given free to people. They're nutritious meals through Eaton Park. And we expect to give out about 1,000 meals tomorrow in Jeanette. And they're also available for people without children who are living in that community. Through our Open Your Heart to a Senior program, we are now doing grocery shopping and delivery for people with disabilities and older adults. And that information is all on the resource page of how you can access it through a phone call to our support group, and they will get people's grocery lists, their form of payment, go and get their groceries and bring them to their house for free. So a great new resource that we have available. And the final thing I just wanted to mention is that we heard this week that the Westmoreland County Emergency Food and Shelter Program will be accepting applications for its annual funding. And we also have a special COVID-19 funding that's going to supplement emergency food and shelter programs in the county. So that announcement will be out, and applications are due May 15th. It's going to be a pretty quick turnaround trying to get these funds out as quickly as possible for agencies who are supporting food, shelter, and providing supportive services. So that's what I have. Again, all resources I have been giving to Dirk, and he's been adding them to the county page. So thank you.
Awesome. Thanks so much, Alyssa. I appreciate that. Dirk, Mattson, do you have anything for us today?
Yeah, sure. I think we're close in identifying an emergency shelter. Dan Carney has found a place. We're not really ready to announce where that is yet. All the details haven't been tied up in a bow yet, but we hope to very soon do that if this location works out. There were a number of questions about that from you guys out there in the audience asking about that. So I think we're really close, but we've been close before and it hasn't come through. So none of us are holding our breath, but if Dan's out there listening, thanks for identifying a place for us, and hopefully that'll come through. I also wanted to say that the answers to the questions from last week should be on the website today. I got back to everybody individually by email about it. Some of the questions relating to emergency shelter, I listed out who all is on this ad hoc task force that's trying to get solutions. So if you want to find out who's involved with it, just go to our webpage probably later this afternoon. It should be on by then, and you'll be able to find out. And that's all I have, Phil. Thanks.
Great. Thanks so much, Dirk. Dr. Fox with Excella Health, are you with us? Dr. Fox, are you on mute maybe? I know you were with us before the call started. Are you still with us? Looks like we're having some audio problems with Dr. Fox. Dr. Fox, if you can call back in or try your mic a little bit later, that'd be really helpful. So we'll just go ahead and go straight over to Bud Mertz, and we'll check on Dr. Fox after Bud. Go ahead, Bud.
Thank you. Good morning, everybody. Two things I want to cover today, and as we talked about the resources, but first I'm going to talk about what our data mining is and how we use this information. I have staff here at the 911 center that reviews the 24-hour calls that come in, and we're looking for trends. When we initially started our roll-up as far as data mining into the COVID crisis, the one thing that we were concerned about is, the first thing was the protocols that we would ask questions for to see if there was, if any of the questions related to a yes being that they're possibly were symptomatic to COVID. We've expanded that data mining also to include some of the trends that the secondary effects of the COVID crisis that might be out there. So we're looking into issues such as, our cardiac arrests. Is our cardiac arrests up more now than they were before? And is the trend is that they're afraid to dial 911 or to call for an ambulance or go to the hospital because of the COVID crisis, and they're waiting too long, and looking at that stuff. We're also looking at domestics, where everybody's stay at home, and that might be an increase, as well as mental health calls. We call them psychiatric calls, but the mental health calls that we review. And the latest one we're looking at is fraud. Is there, people are buying an awful lot of things online. Is their credit cards being compromised and those type of stuff. So aside from mining that information, you have to then make it actionable and taking that information. A lot of the information we'll give to the EMS community or the police departments and those stuff. But more importantly, what we want to do also is use this information for public education. So if you follow our Facebook page and we get a ton of shares with it, we try to produce a product. There might be one existing out there already, or if not, we'll design one our own that directs people for help if on those things. So we've done it for as a good example. We've used on the mental health cases. We've used the links that the county mental health has with it to direct them for help. We talk in the fraud side. We've had a couple different educational pictures or platforms on there as far as how to be careful and all that. So I mean, I think that's very important, the public education piece. Our Facebook account probably is up past 9,000 right now. It's amazing. True, there's over 300,000 people in Westmoreland County, but if that one person shares it and they go with the number of people they have, and so on, basically, hopefully that message gets out well. We also put this information on the county's webpage as well to make sure that people who get onto our webpage has that information. So I think that's a very important tactic that started out with just the medical side, but is now expanded into it, and public education is an important piece. Second item I want to talk about is the resources and the distribution of those resources. Very fortunate, thanks to Phil and the foundations, that we were able to acquire the surgical masks and surgical mask there. We had stepped up to the plate since we already had an infrastructure in place for distribution as we distribute those PPEs to the police, fire, EMS, and municipalities like that. Since we had that infrastructure in place, we told them that we would be glad to support the nonprofits, the distribution for the nonprofits. So the masks arrived, and what we're doing is actually we went down and picked them up. But what we're going to do is there's a email address. It's along with the email address, there's a resource request form. Now this is an official form, but for every piece of PPE we distribute, we have to have a paper trail for it. We have to really show where where it goes. No matter if the supplies were, sent to us by the state, or if the supplies were sent to us or purchased by the county or donated to us, we have to have a paper trail, both on what we receive and what we push out. So there's a resource request form that's on there. I don't want anybody too worked up over a lot of the questions, because it might not be germane to this operation. But the most important thing is who is the point of contact. So we have all the point of contact information, name, their position, and return contact information that we have. The second of all is what do you want as far as the quantity goes, and that we can make sure that we have that. And then we'll get into the distribution point of it, where our distribution has to be non-contact. I have to protect my staff. What we normally do is our supplies are out at the Arnold Palmer Airport, and we will prepare a package for it. We'll put it on the other side of the fence with a clipboard, and you sign the receipt of the equipment, and then we'll go out and we'll pick it up. But it has to be non-contact. And but as far as the resource request form, again, don't get too worked up about it. Just make sure you have the point of contact and the quantity and that type of stuff. If there's anybody that has difficulties in picking the equipment up, we'll work something out. We've already, besides distributing stuff to nursing homes and all that, where again, it's non-contact, but we have a drop-off point and that type of stuff. I would prefer that you would pick it up, and it would be out at the Latrobe Airport. You're familiar with how the new entrance is to the airport. If you get off at 30, take 981, like you're going to the airport. You go halfway through the roundabout. You continue on 981 about another quarter of a mile past the roundabout, and there's as you crest the hill, there's a beige building on the right-hand side. That's our regional operations center, and that's where our supplies are. And you just pull into the driveway there, and you'll see everything set up for you. Any questions? I believe that there should be a phone number attached with what you send out, Phil, but if not, you can always give me a call at 724-640-6603. That's my cell phone number. But we're happy to be part of this process too, because the whole mission here is to stop the spread. And I commend the foundation for coming up with the initiative to do this. And again, we're just glad to be part of that. That's all I have.
Thanks so much, Bud. Your team has been such great partners in all of this, so I really appreciate you setting up that system. And once again, just to reiterate Bud's point, if anyone has questions or concerns, so you can reach out to me, to Bud, whoever. The point is to get it in your hands, not to get caught up in the logistics of it all. So we'll help you through the logistics if it gets cumbersome. So, Dr. Fox, I think, are you back with us now?
I am. Can you hear me?
Yes, please go for it.
So things are going well at Excella Health. We currently have 4 inpatients, which is a definite decrease from the past, so that's the great news. We still are seeing outpatient cases, and we had a little bit of a blip around April 22nd, so we're watching that very closely. At this point, we are going to start doing some elective surgeries starting Friday. We'll be doing those cases at Westmoreland Hospital, at Frick Hospital, and at our Excella Square at Norwin Ambulatory Surgery location, as well as some GI cases at Laurel Surgery Center. We do have testing available, and we will be testing individuals who will be undergoing procedures prior to their procedures. We do have adequate PPE. We are actually in the process now of looking into something called elastomeric masks. Those are essentially very much like an N95 mask, but they are not disposable. So they're something that can be cleaned and reused really until they break. And it's something that I think once we learn how to use them, obtain them, and clean them, it may be something that would be of value to other locations, and particularly our skilled nursing facilities. So as we gain information and expertise, we'll be sharing that with our skilled nursing facilities, because I think, you know, as we move into the future, we know that until a vaccine has been developed or until there's a reliable medication treatment for COVID-19, it's likely that there'll be additional waves of the illness, if not now, in the fall, winter, and into the future. So this is something that we think will be very helpful to us and may be very helpful to our community colleagues as well. And lastly, I guess I would just say, and I mentioned this last week, we've been so gratified at the outpouring of support from the community for Excella that we have decided as an organization and as individuals in the organization that we wanted to do something to give back to all the people who have been so kind to us. So we have mounted a campaign for the food bank, and to date we've raised $63,000. So we're very proud of that, but we're very thankful to the community for all their support for us.
Thanks, Dr. Fox. No, that's really great. Thank you. I appreciate your time once again, giving us an update. It's very helpful. I'm going to move on over to Jason Ragoni, who's going to talk to us a little bit about the COVID Service Providers Impact Survey. Jason, you with us?
I am. Hey, good morning. Thank you so much for inviting me to participate today. As Phil had mentioned, my name is Jason Ragoni. On the agenda, it shows that I'm with the Industrial Development Corporation. I think for discussions today, I also serve as the county director for the Department of Planning and Community Development, and that's really the role that I'm speaking in today. It's been an opportunity to be on and part of the leadership committee at the county level and see what everybody else, especially emergency management, has been providing and getting updates from Excella Health and the other healthcare providers. They're really doing a great job in providing those services. Our role under the Department of Planning and Community Development is twofold. Number one is to plan and support our communities and through the role of planning and community development. But also, probably more specifically, and this is kind of where this question goes today, is we also receive a significant amount of funding from the federal government through the Community Development Block Grant Program, through the Emergency Solutions Grant, and through a affordable home housing program. That kind of led us to the conversation of saying, when we go to program funding and working with the county and understanding all the impacts that they're seeing throughout all of their departments that provide services to our residents and the general public, is truly trying to understand the impacts across the board. And I'll get to the survey here in a second, but I think that this is an important aspect. We had a conversation with municipal leaders yesterday, municipal managers, because there's impacts at the municipal level and the services that they've got to provide to their residents and constituents. And some of the more seasoned municipal managers are basically saying, we said to them, what are you seeing and how are you addressing those issues? And as I mentioned, one of the more seasoned municipal managers says, we've never dealt with this before. We're kind of building the ship as we go. We're putting one foot in front of the other. And we kind of discovered that even about a week ago, saying there are a lot of issues I think that we're all trying to handle, right? It's a triage situation right now. And we felt that it was important to be more educated, go through an exploration process, try to gather as much information as quickly as possible to be able to better understand the impacts that you all are feeling, that our municipal officials are feeling, the county department heads are feeling, and then being able to understand and make educated decisions about how to program funding, what is most important now, what may be important down the road. So we developed a 10-question survey. That survey is going out to all 65 municipalities in the county, will be sent to all of the department heads and row officers at the county level, and it will be also shared with human service entities like yourself. And again, the important part here is to gather and gain as much intelligence as possible to be able to plan and to be able to program funding to be able to support all of those needs. It's also understanding, what is highest priority. So the survey is a 10-question survey. It focuses on first, what are the impacts you felt so far to date, whether that is financial, whether that is at, within your, I'll call it your customer base or your constituency in which you support services to. Maybe that's human resources. Maybe that's supplies, as we talked about medical supplies before. Then the second question is broken down into, what do you plan on seeing based on your knowledge and expertise over the next 6 months? And I know that's a tough question because we just don't know. We're still learning as we go. And then the questionnaire goes on to what you may see after 6 months to 18 months, really the recovery phase. And so we're trying to break it down into those types of tiers instead of just saying, throw all your information and saying, what are the impacts and what are your needs? Let's break those out and plan accordingly like a good department head or agency director would do. That way, as funding comes in, because it's going to come in cycles, we can start pulling pieces out to be able to support past, already current needs, emergency needs, and then long-term recovery needs. We're also asking questions, maybe where are you going to be seeing funding coming from? There's a lot of money coming out from the state and federal government, certainly your agencies. The foundation has been wonderful to be able to put money in terms of immediate and emergency needs. So there's a lot of funding out there. We also, we have to go through that exploration phase of saying, where is the money, who's getting what, so we can be intelligent with our decision and programming. Once we get all that information in, and it's a quick turnaround. We're only opening it. It already went out to municipalities and to county department heads as of yesterday. It will be sent to all of you today. And we're asking, because it's only a 10-question survey, to get it back to us by Monday of next week. So again, it's a quick turnaround. We ask for your diligence on it, but it puts us in a place of a better decision-making process as we move forward. We did not incorporate businesses into this, although we know that small businesses are being impacted tremendously. I put my other cap on, being the director of the Industrial Development Corporation. I have tenants and companies in our industrial parks that are basically frantic on what they're going to do moving forward. We're handling that a bit differently in terms of intelligence and information gathering, but that's also an important piece moving forward. So that's the survey. We certainly would love to hear from you, be part of the solution, be part of the information gathering, and we'll deal with this as a team. So that's all I have right now, Phil. The survey will have my email address on it, so if you have any questions, you can certainly shoot that to me. But again, if you want to talk with me directly, I'll give you my phone number right now, which is 724-830-3601. That's my office number. My cell phone number, which I'm at home working 3 days a week, is 724-454-7490. Thank you. I don't know if there's a chance to take questions now.
Jason, if they have questions, they'll throw that in the questions tab, and then we'll answer them afterwards. We'll send out, that's part of what we do afterwards, we'll send out answers to all the questions just to make sure that we are wise about our time. So, but Jason, I really appreciate you jumping on and talking about that. Once again, really important for us to provide feedback to the county so that they can use those funds appropriately and how they need to be allocated. So thanks for your time. We will have that survey sent out to everyone right after this. So please keep your eyes open for that. And once again, it's a short window of about 5 days to turn that around. So please get that done. It's only 10 questions. Would appreciate your help. I'm going to move on over to Dr. Conway with the IU. Dr. Conway, you have updates for us.
Yes, thank you very much for the opportunity to share this morning. First, wanted to share that school entities continue to implement their continuity of education plans, and that is going well. Right now, school districts are struggling with decisions and the uncertainty around graduation ceremony. So I know that's something that right now people are dealing with and trying to figure out what that may or may not look like, over the next few months. Also wanted to share that the intermediate unit on behalf of the 17 school districts and the CTCs, as well as the charter school, have been working with the Consortium for Public Education to develop a request for information proposal for the R.K. Mellon Foundation that they are offering around recovery from COVID-19. And led by Dr. Matt Thomas, our Student Services Director, and Denise Needison, our Early Intervention or our Early Childhood Administrator, they've developed a request for proposal that was submitted on Friday. And really the problem that we identified was, of course, access, to technology, the internet, as well as devices. But we're also hearing and seeing that teachers and families and students are, especially in the 3 to 5 age, as well as K to 6 grades, are struggling. And that's where we have the greatest concern around regression of learning and skills. So therefore, our grant is really focused on ages 3 to 5, as well as then kindergarten through 6th grade, where we're proposing that we would provide devices that support online learning through this grant. Also using human-centered design to foster problem solving for families, within communities of collaborating organizations. And also our request for information is to provide professional learning activities that are going to provide teacher training, as well as parent workshops that really focus on supporting children in the online setting. So we hope to hear something, I believe, at the end of this next week, if we're going to be invited to do a full proposal, and then that full proposal is going to be due mid to late May. So it's a quick turnaround. We feel pretty confident we have a good solid application base, and we hope that they do invite us to apply, because it's going to help many, many children and teachers throughout the county. Lastly, we just wanted to say, again, thanks to emergency management for all that they're doing. The IU, in concert with school districts, have been producing 3D masks for nonprofits, and however emergency management sees fit for those 3D masks to be used. We just handed over, I think, 90 masks, and we're expecting another 110, 115 to come emergency management's way by the probably beginning of mid next week. Other than that, thank you very much, Phil, for the opportunity.
Great. I appreciate all that you do. Thanks so much. Tim Phillips, I believe you're with us this week. I know your audio didn't work last week. Are you with us today?
Good morning.
I can hear you loud and clear. Go for it.
Great. Hey, thanks for the opportunity. Nice to see everybody. I just wanted to give a quick update, and thanks for the invite to inform everybody about what the Overdose Task Force is doing. We're kind of in a very challenging situation, like we all are, dealing actually with 2 pandemics at once here, with the issues of substance abuse and COVID-19. So we have a compounded kind of challenge in front of us. I do have some interesting news locally on the OD trends. We haven't really seen an uptick in any overdose deaths that should be alarming at this point. I talked to Kenny, our coroner, about a week ago, and we're on track to be pretty much in sync with where we were last year with our numbers at this point. The first quarter official numbers haven't come out yet. We are seeing an uptick in methamphetamines and other substances as well. ODs are still occurring, unfortunately, but many are surviving, and we contribute that to a lot of overdose prevention efforts, including Narcan and all that. We also are concerned with access to social supports. People in isolation today, we really want to be mindful of the message of with social isolation and all this. We don't want people at home using by themselves, simply because they're at a greater risk for overdose. There's no one there perhaps to revive them with Narcan if they do overdose. And so we're doing a lot to try to educate the community as much as we possibly can from a distance on those issues. We've recently instituted a Narcan porch drops. So we can, if someone needs a Narcan, we can provide them with a Narcan. and drop it off at their residence if that's the method that they would prefer. It's safe, no contact, and it gives people the opportunity to be proactive in case someone overdoses in their home. We also want to be concerned with what we're seeing in variances in our drug supplies. The purity seems to be questionable. I've been in contact with the folks at Allegheny County, and some of the stuff that they're seeing in their labs is very strange. Things aren't, the dope on the street basically isn't being cut with the same traditional things that we've used to see, simply because we suspect that the supply has been altered coming from China and whatnot in Mexico. And so we are seeing some adulterants, which is concerning. Law enforcement really hasn't seen any significant issues. We still see, a great supply on the street, but we are concerned with what is in those concentrations. People that are using drugs currently have a lot of medical implications too, that complicate the impact of COVID-19 with folks who may be certainly using substances. We expect to see a spike in OD deaths, unfortunately. The forecast, and we are trying to be as proactive as possible. I've been in contact with folks in my peer group throughout the Commonwealth of Pennsylvania and actually the tri-state area as well, to see what we can do to be in place to provide services necessary. We're looking at the increase in deaths of despair. One alarming statistics that we found is that for every 1% increase in unemployment, it was associated with a 3.6 increase in opioid-related deaths. That's alarming right there to me. This is a study from 2017. And so, we're concerned with the increase perhaps in deaths of despair, and we're trying to do whatever we can to stop those trends. We're doing a lot through our public education. Recently, we've reached out with social media. I've been speaking virtually to different community groups, church groups, and all that to give them as much education and awareness as possible. And also referrals. Sometimes people have a lot of misconceptions that, I've had a lot of folks recently say, we can't get our loved one into treatment. Well, treatment is still going on. They're taking the safety mechanisms and following CDC protocols, and so treatment is accessible. There are some treatment places, and I've been in touch with many of them locally, perhaps that aren't taking people with other medical conditions such as maybe asthma or COPD because of the medical complications, but we can get those people into another area of treatment perhaps. So we've been networking, do a lot with folks, virtual trainings. We're working with the reentry, of course, which is very, very important at this point. People coming out of any incarceration or any other institution, including treatment. Working with the Southwestern Pennsylvania Harm Reduction Coalition. We're doing some virtual trainings coming up with harm reduction and all that. And I would encourage anybody that needs any more information to follow my page on Facebook and to check out our website, getinwestmoreland.info, for more information and resources. That's pretty much it in a nutshell. I want to thank everybody for the opportunity. And this is just a nice way. I appreciate the calls, Phil, because this is a way for all of us to collaborate and see what everybody else is doing. It's all about connections. I always talk about people suffering with substance abuse disorder. The opposite of addiction is connection. Connection makes all of us have a healthier community. So thanks, guys. Keep up the good work.
Thanks, Tim. I appreciate that. I appreciate all your work and for taking the time to do a little quick update. Jennifer Miller, do you want to give us an update from the food bank?
Sure. Thanks for having me on again this week. Just to update a little bit about what's going on. First of all, thank you to 211 for the referrals. It is such a huge help for us. Our call volume has tripled, if not more. And, having 211 out there to be able to refer people to where they need to be to get their food along with us is such a great partnership. So thank you. And also thank you to Excella Health. They are well over $63,000 at this point with donations. And, you know, these donations from Excella are coming from their staff. So it's truly amazing that the amount of people that are stepping forward from Excella to help out their neighbors even more than what they're doing in their normal day-to-day jobs. So we truly appreciate that. At this point in time, going through 7 weeks now, we're well over 2.5 million pounds of food distributed. That's very high compared to what we normally are at this point in time. We're seeing about 9,000 families per month. That's a roundabout figure at this point, but that's about 2,000 more than what we normally see on a normal basis. We're seeing a lot of referrals, needless to say. We are getting a lot of criticism, needless to say, for not doing mass distributions. We are sticking firm to the fact that, you know, when you're doing mass distributions, you're taking another resource away from a family, and that's their money for gas. So they're going to a distant distribution. You know, every food bank is different. And, you know, we feel that keeping people in their communities rather than having them go to a site that may be far away from their home is the best for their families. We are dealing with emergent situations for people who can't wait to go to their food pantries. We're giving food boxes out from our facility here in Delmont, but we want to assess their situation because we're not only referring them to get food, but we're also talking to them about their SNAP benefits. And if they're not on SNAP, are they, you know, can they apply? And we are helping them through that process. We're trying to refer them, you know, to other resources, you know, over and above what we're able to do for them. So, you know, there's a lot going on here that we want to help out the holistic part of it as much as we possibly can in partnership with 211 and in partnership with other human service organizations. So there's a lot going on right now. We're still pre-boxing, needless to say, and as far as we know, we're going to be pre-boxing for the foreseeable future. We have to plan ahead, so we need to make sure that we are prepared for this go round and possibly the next go round, God forbid, if we have to do this again. So we're also, many of you have probably heard about the COVID food assistance program that the USDA has put out. I think it's more popularly known as the Farms to Family program. We are not getting into the packing portion of it because we don't have as much room to do that here with pre-boxing, and our freezers and coolers are full right now with pre-boxed items. But what we will be is a recipient agency, and at that point, you know, we're hoping to partner with the fairgrounds, and we are in talks with them to have distributions there. They will be more of a mass distribution type of distribution. When those will happen, we're not sure. It's all up to when we start getting the food in, but I'll be able to update that more as we hear from the USDA in regards to who they're awarding those contracts to. That will be for anybody as well. There will be no income guidelines. What we are encouraging people to do right now, all of our partners here on the phone call and anybody out there that are working with people, please, if you encounter somebody who is in need of food, please have them contact the food bank, and we will assess their needs. We will get them to the closest food pantry, or we will bring them in for an emergency food box. And if they can't get into us, we will make sure we get to them. So we just really want to assess the need at this point and go from there. I believe that's all we have for right now. We're changing just like everything else. So I appreciate the opportunity to speak to anybody. And if you have any questions, please feel free to call me at 724-468-8660, and my extension's 15, and I'll be glad to answer any of your questions that you might have. Thank you.
Thanks, Jennifer. Thanks, Jennifer. Always going the extra step. I really appreciate your time and the update and all the work that you and your team are doing. Thank you. Deb Thakrar, are you with us today? Can you give us a little update on Feeding the Spirit and your Saturday distribution and all the other stuff you guys are working on?
I am. Can you hear me okay, Phil?
Great, go for it.
Okay, thank you everybody for allowing us to come on again. I'm thrilled with everything that everybody is reporting. We really have seen the community come together for, this was our second meal distribution for Saturday at St. Clair Park. And our first meal distribution 2 weeks ago, we had 230 meals that we gave out. About 75 meals were made and prepared by local restaurants who generously donated them. The rest we purchased from the nutrition group, and those were individual packaged frozen meals. We were very thrilled with that. Last week, as the word got out, we distributed 528 meals. Which was quite an increase, and it was pretty crazy in that hour, but it was just overwhelming the support we got. The restaurants gave us much more food. They doubled what they were donating. We purchased more frozen meals. We also had Western Pennsylvania Diaper Bank come and do a distribution of diapers for the families that would need them. Senior Life donated some toilet paper. Distributing company, Vicini, donated water. A lot of people have donated monies to the restaurants to help them continue to prepare these meals. So the outpouring has just been amazing. So this week we're really gearing up for more, and the local restaurants who have been involved have committed to at least 250 meals for us this week. So it's really exciting, and we, like everybody else, we just keep modifying and streamlining and changing as much as we have to meet the needs. I think it's our emergency calls have really been centered around food scarcity, but also homeless placement at this time. We work in conjunction with all of the shelters, and I looked at the numbers. In April, we have placed 48 individuals, homeless individuals, for temporary placement. That is an increase from last month and an increase from last year. So we are very concerned about keeping people safe and keeping people off the streets, and we continue to move forward and work and partner with Welcome Home, Union Mission, Blackburn Center to make sure that we can keep these individuals safe and warm and fed. We also distributed face masks at our Saturday meal distribution, and it was very well received. And thank you, Mr. Mertz, for giving us some of those masks. We will probably be putting a requisition order in again for more. We are just, we're going with the flow, but we are so overwhelmed with the generosity of the community. So thank you, everybody, for allowing us to partner and do everything we can do to continue to make a difference in this challenging time. That's all I have.
That's really great. Thanks so much, Deb. I appreciate your work and glad to see you're able to meet the need at this point. Once again, feel free to reach out to Bud if you guys do need more masks. I know that the demand is far greater than you had originally anticipated, so feel free to reach out. I think our today is Heather. Heather, are you with us? Can you give us a report on adult support groups?
Yeah, hi, I'm here. Thank you so much. Can everybody hear me?
Sounds good.
Yeah. Yeah, so I'm really excited to be here. The quarantine has really given us a challenge on how to reach out and meet the needs of the community. I am the outreach coordinator for Mental Health America of Southwestern PA, but I'm also the chair for the Ray of Hope, which is the Westmoreland County Suicide Prevention and Awareness Task Force. And that's very important that I add that piece because we know in this time that we are expecting an increase in suicides, not just throughout our community, but from what I've been seeing nationally too. So we were probably about a week into quarantine and started discussing what we can do to try to reach people that are in their homes and at risk. And so we thought of doing a Zoom support group, and it's really been awesome to see how it's already growing. So about a month ago, I started the first one, and it's on Wednesday from 6 to 7. And this support group is open to anybody that would like to attend. If you're feeling stressed, if you're feeling overwhelmed, but not just for that, it's for people that just need social connection. And it's been amazing to see who has been attending the group. because it's people from all walks of life, all ages, all different circumstances, and we come together for an hour just to talk about whatever's on people's hearts and the things that they're struggling with. But I really try to turn it around to something positive that we're sharing. Last night I had talked about how much humor and laughter is good for us. So I tried to incorporate almost that whole hour of us just sharing stories and laughing and, you know, just talking. It was such a great hour. But with that, we started talking about maybe more specific populations that are at higher risk. So about 3 weeks ago, we started discussing that I needed to maybe incorporate a couple more groups. So with that, on Tuesday, just this past week, I started them every Tuesday from 1 to 2. I'm doing a mental health support group, and that is for people, anybody struggling with any type of mental health symptom. And in saying that, it's not a clinical group. This is just a social time for people to get together, to connect, and like I said, to talk about what's on their heart. So we had several people that attended last week, or this last Tuesday, and it went very well. And then Wednesday, we talked about the LGBT group that is at a very high risk for suicide. So in saying that is very important to us that we can get out and communicate with them. Westmoreland County has very little support for that community. So in saying that, we know that there's a sense of urgency to be able to meet that need. So I had my first group yesterday from 1 to 2, and that is every Wednesday from 1 to 2. And that was great. It was exciting just that we've gotten it off the ground, that we've given the people the opportunity to come together, to tell them that they are important, that they're wanted, that they're needed, and just so that they can get out and share with other people in that community to please join us in our upcoming groups. I'm really excited about them. And not only are we going to continue to do these groups through the quarantine, but people are getting excited about them. They're appreciating them. So even after the quarantine, as long as the community wants them, I'm going to continue to do these groups. I'm trying to think. I did do a flyer for each one of the groups, which I know the county has really had a great effort in getting that out to people. And I believe those links are on the Behavioral Health County website that people can link to. My cell phone is on there. I wanted my cell phone on there so people could reach me immediately. They can call me, they can text me, and my email address is on there for them to reach out to me, even if they had questions. I've had a lot of providers reach out to me and just ask questions for their clients that they can get the information to, so it's definitely, to me, I see that it's getting out, and hopefully it's making a big difference for a lot of people. So I think that's maybe all I have.
Okay.
Thank you. Yeah, thank you for giving me the platform to be able to share.
No, I really appreciate it, Heather, and we'll make sure that all of the information is up on the website. So if folks have questions about the support groups, they can go check out get that information from the Human Services Network website on the county's page. Once again, you can find that website at the bottom of your screen now. That rounds out all of our speakers. So thank you all once again for joining us this morning and for being a great connector and a great partner in this process. Before I sign off on behalf of the Community Foundation of Westmoreland County and the West Coast Nonprofit Network, Dirk, do you have anything from the county, or Alyssa, do you have anything else you want to add?
No, thanks, Phil.
Okay, great. Alyssa,
Thanks, Phil.
you good?
Nope, good. Thanks, Phil.
All right, great. Well, thank you all for joining us. Once again, let's continue to work together and to get through this. We'll see you all in a week. Thanks so much.
Bye. Thank you.
Bye.